So my name is Dr. Charlie Peterson. I'm an orthopedic surgeon, and I work at a clinic called Orthopedic Specialists of Seattle with 8 other surgeons. I am a sort of a throwback to the older days where I do a lot of different types of orthopedics, but my practice is about half total joint replacements and half sports medicine, which involves shoulder and knee surgery and other areas of the body as well. I grew up in Seattle, and I went away to college, as far away as I could get from my family just because I was at that age, to Dartmouth College in New Hampshire, and came back to the University of Washington to go to medical school. While I was at University of Washington, I fell in love with orthopedic surgery. I thought I probably would, but I had a chance to try all different types of medicine and thought that would be the thing for me. So I went to the Mayo Clinic, to the residency program there, which is a 5-year program. The reason I went there was because the training there is spectacular. It's an odd place. The Mayo Clinic is, if you imagine taking a world-class medical center and dropping it in the middle of a cornfield, that's what it's like. And so my wife, who was from New York City, wasn't super enthusiastic about living in Minnesota for 5 years, but it was fantastic training, and I couldn't imagine a better place to learn the craft of orthopedic surgery. So then, when I was done there, I wanted a little bit more experience in shoulder and sports medicine surgery. So I went and did a fellowship in New York City at a place called the Hospital for Special Surgery, which is a totally orthopedic hospital geared toward all forms of orthopedics and only orthopedics, and spent a year there, which was a fantastic experience for me. Not only did I learn sports medicine and shoulder surgery from some world experts, but I also got to take care of the New York Mets baseball team with Dr. Dave Alchek, who was my mentor there, and also assist Dr. Russ Warren with the New York Giants football team somewhat as well. That was a fantastic foundation between the training I received at Mayo in total joint replacement and adult reconstruction surgery of hips and knees and shoulders, along with the sports medicine training I received in New York City to come back to Seattle and start practicing. And when I started to practice, I started with my dad's practice, which was fantastic. I was able to spend 12 years with him, giving him a hard time and vice versa as we worked together. And then when he retired, I moved to Orthopedic Specialists of Seattle. And I've been here for 14 years now, and it's been a fantastic experience to be here as well. So orthopedics is a vast specialty. It has an enormous number of different body parts of the skeleton, basically from the neck down, in which we work. And during your training in residency, you have a chance to be exposed to all of those different types of things. It's kind of like going to college and taking a major. You can try a lot of different things and you focus in toward the end on what you want to do long term. And in that training, we do hand surgery and foot surgery and pediatric surgery, spine surgery, tumor surgery, all types of things. And the areas which I found the most fascinating were the adult reconstruction of joints, mostly hips and knees with joint replacement, and then sports medicine and shoulder surgery, which is kind of sports medicine tends to be a combination of knee surgery and shoulder surgery mostly. The reason for that is that in the joint replacement realm, it's always been fascinating to me to take someone who's incredibly disabled by their arthritis or their deformity or the destruction of their joint and give them back basically a new joint and a new life. It's a remarkably humbling and rewarding experience to be able to do that. On the sports medicine side, I was an athlete growing up. I was a basketball player in high school and I was a rower in college, and I had most of the injuries that I treat now. And most of us who are in sports medicine are ex-athletes, and having that treatment of those exposes you to the process of diagnosis and treatment and recovery. And working with young athletes is its own special reward in that you have these very highly motivated, highly conditioned, healthy patients who are very much seeking to get back to that level of expertise and talent and sports performance that they had before they got injured. And that's also a really special place to be able to work and to help them along that journey. I grew up in a family of service. My father is an orthopedic surgeon, now retired. My mom was a teacher. And we were always taught that to those who are given a great deal of opportunity, you need to provide back the responsibility of caring for other people. And medicine's a wonderful space in which to use one's intellect and one's training and one's knowledge to help someone else in need. And I've been a patient myself for many things throughout my life, and I've been on the other side of that conversation with the doctor. And even though I have medical knowledge, it's a scary and vulnerable place to be. And so when I see a patient for anything, from a bump or a bruise all the way up to needing surgery, major surgery, reconstructive surgery for their joint, I want them to walk away from that experience educated as to what we're thinking is going on here, so they have a diagnosis, they understand what the process is going on in their body. because that's oftentimes a black box. They don't know anything about this, and you say arthritis or ACL tear or rotator cuff tear, and that's a blank canvas. So I want them to walk away with the diagnosis and the understanding of the process of what are the different options that are available to them for their treatment. And I like them also to come away with the idea that this is a collaborative process and that I'll be with them all the way through to whichever end they wish to go, for better or for worse, because things usually go well in surgery, but sometimes things happen that are complicated and they need a physician or a surgeon who's going to walk that path with them so that they at least have the comfort of knowing that there is someone who is going to be invested in their recovery and is going to do the best they can to see them all the way to the end of the journey and hopefully a successful end. And that gives them, if nothing else, the reassurance that it's not quite as daunting or as unknown a task as they might think when they come in.